Centeno. And obviously, many of us use platelet-rich plasma for MSK uses, and that's because it has more than 100 positive randomized controlled trials behind it for that area of medicine. But interestingly, when you go out there and search for some of those papers, other uses come up. And while I've no desire to use PRP in urology, for example, it is interesting to see what else is out there with regard to the PRP literature and randomized controlled trials. So if you start going down that area, we can see for infertility, we have 7 randomized controlled trials here on PubMed. And then if we switch that over for wound care, we have 61 randomized controlled trials. And then if we switch that over for bladder conditions, we've got 2 randomized controlled trials. And if we switch that over again for alopecia, we have 45 randomized controlled trials. And if we switch that again for erectile dysfunction, we've got 9 randomized controlled trials. And if we switch that over again for fistula repair, we've got 13 randomized controlled trials. So obviously, PRP as a treatment is just killing it. It's not only effective for MSK uses, but for many other uses as well. Thanks so much for watching and have a great day.